everybody. I welcome you all to the first lecture of Speech Rehab RS channel, that is how to approach patients with communication disorder. We thought that before we start on what are the disorder types and how do they present and what are the treatment strategies, I think the most important thing is to know how to communicate with people or patients who have communication disorder. You're gonna learn a lot of stuff, a lot of new stuff during this presentation. And if you have any questions, any query, or any suggestions regarding these slides or presentations, you can always write them down in the comment section below. Okay, so without any further delay, I'm going to start the presentation. The learning objectives of the presentation are communication disorders, barrier for patients with communication disorder, common errors done while approaching the patients with communication disorder, and the frame model. So we're going to divide the lecture or the presentation into two parts. The first part is going to cover the first 3 points, and part 2 is going to cover the frame model. So giving you just a quick overview of what are communication disorders. Apparently the communication disorders are divided into two categories: language disorders and speech disorders. Language disorders may contain aphasias or phonological disorders, and speech disorders might contain dysarthria, articulation disorder, or voice disorders, etc. So we're gonna make lectures that cover we'll try making lectures that are gonna cover each topic. So we're just gonna move on. Okay. What are the barriers for patient with communication disorder? If we hold on here for a second and think, what were the barriers that we faced while communicating with the patient who was having communication disorder? You can always write it down on the comment section. It's going to be a very good experience. We guys can interact with each other like this. For me, as a healthcare provider, the main issue that I faced was that the patient was unable to understand what I was saying, and on the other hand, I was unable to understand what the patient wanted to say. So that was a very big thing for me. But according to the researchers, what the patient face is, number one, loss of autonomy in healthcare decision making. That's a very big point, because if you have ever heard about it, that clinical decision making is a pyramid approach. There is the healthcare provider on the one end, the primary caregiver on the other, and the patient is at the top. So all three, or this whole, all of them are involved in making a decision regarding the functional outcome, the therapeutic approach to be taken. So if the patient is having a communication disorder, this is the first thing that they're going to lose. So keep this in mind while dealing with those patients. They are at the increased risk of medical errors. Well, supposedly, when you are unable to understand if my patient is in pain, when did the pain start, and how does that pain feel? Are you feeling dizziness, or are you noxious, or are you are you constipated? All these little but significant symptoms, the patient is unable to communicate, so they are at the high risk of medical errors. Being treated by healthcare providers as if they're intellectually impaired when they're not. This is also a very important point. Please do keep this in mind, that communication disorder is a one thing and intellectual disability or intellectual impairment is the other thing. It is not necessary that if the patient is having communication disorder, he will be intellectually impaired. Never. There are a lot of scenarios in which the patient is intellectually stable and he did not, or he has not lost his intellectual ability. Especially in the case of aphasia, people perceive that the patient is unable to speak and all, and he is also intellectually impaired. Aphasia is a disorder in which only communication is impaired. So do guide other people that please don't deal patients like they're intellectually impaired. They can feel, they have same emotions, they can understand what the people are like, they can understand, even they can understand the contextual cues. So please be very careful when you're dealing with these people. And the most significant barrier is that many healthcare providers do not know how to communicate with them. These are not the typical patients that come into the OPD or IPDs. These are the patients for which you need to adopt or adapt a very customized and a systematic approach. So please be very careful and do try to understand that yet yes, we don't know how to we don't know how to like interact or communicate with them. If you realize that you don't know, then you're just gonna learn. So realize where like where are you, like where are you shorthanded. Okay, so moving on. It has been reported that the patient with communication disorder are less satisfied with their health care than the peers without communication disorder. Well, then again, um, there are a lot of points, there are a lot of points that can be highlighted here. First of all, they're unable to tell what they wanted, or what is the what is the what is the actual picture. So it's about the guessing. The most of the time, you're at the guessing corner while you're dealing with the patient. Patients with communication disorder face difficulty when understanding information being presented to them, or expressing themselves can make it very difficult to exchange information accurately and efficiently with healthcare provider in context of typical healthcare encounter. As a result, the adults with communication disorder are at a higher risk for adverse event in healthcare professional. So, what are the common errors done while approaching the patient with communication disorder? Well, when I was a no voice practitioner or a student with communication disorder, the common error I did was that I was too fast while speaking with the patient, and because of that, the patient was unable to understand, even though he could follow 2 to 3 step commands. So I was using the longer strings of phrases, or even though I could communicate in one word. And facial cues, I wasn't using appropriate facial cues. I wasn't giving them the reaction time. So these are the things that you learn being part of the profession, or with experience, and hopefully with this lecture as well. So what are the common errors that you guys did? So do write them below in the comment section. Medical students typically receive training in effective patient-provider communication, learning various techniques for interviewing patient, including patient-insight decision-making, shared decision-making, and giving difficult news. This training, however, generally assumes that the patient have intact communication skills, and the patient with communication disorder often requires different communication strategies to achieve the same goal of patient-centered care. General medical communication skill training programs do not necessarily instruct the medical students how to match communication support to communication need, to find a good balance between supporting patient autonomy without overly restricting the patient ability to express himself or herself. This is a point where you need to ponder. There are two things, okay? Giving appropriate support and not overly restricting the patient. You have to create a balance. Giving appropriate support, it can be giving the patient time to react, or guessing for the patient. And overly restricting is like, I'm not giving the patient time to react, and then again I'm guessing. It's the same thing, but it has a different impact. For suppose there's a patient and I'm asking like, what do you want to eat? And I know the patient is having communication disorder, and I ask, do you want apple? Okay, so I give him the supposed to respond. What happened? It's a close-ended question. The patient is not gonna say yes or no. The specificity and sensitivity of my question is like not appropriate, and I can still say that I guessed. On the other hand, if I overly restrict the patient and I say that, okay, do you want an apple or orange, and I give him the options, or I give him the visual cues or writing aids, I might be restricting the patient as well. The patient might respond on open-ended questions. So we need to create a balance here. Common errors while approaching the patient. A medical student encountering the patient who is unable to speak but has intact cognitive linguistic ability may resort to asking long strings of yes or no questions in an effort to guess the patient. So this is here when the person or the healthcare professional says, hello there, did you have what did you have rice in dinner? So the patient say yes or no. This is a very wrong approach. You can say to the patient that, hey there, did you have dinner? And the patient would say yes. Can you tell me what you have for dinner? So the patient can guess and say so. In the scenario one, I didn't let the patient take the lead. So in scenario 2, I am like, it's a two-way street. The patient is taking the lead as well, and I'm taking the lead as well. So it's a win-win situation for both. There are several points of etiquette relevant to communicating with the patients with communication disorder that would not be used with the patients with typical speech and language abilities. For example, establishing communication preferences, appropriate use of guessing, and appropriate inclusion of family members or other caregivers. In the last point, what happens is that family caregivers jumps in and try completing the sentence for the patient. This is a wrong approach. Not only this is going to demotivate the patient, but is also going to like take his um like then again take away his autonomy to participate in a um, communicative setting. So do guide the attendants to step back, let the patient and me communicate, and we're gonna ask you when regard for help when we need it. Okay, so frame model, we're gonna cover it in part 2. Hopefully you liked this presentation, and do drop your suggestions, like and subscribe to this channel, and we look forward to your feedback. Thank you.